All right, let's talk about the NCLEX. If you're gearing up for this exam, you know the feeling, right? You're so excited to finally become a nurse, but at the same time, there's this huge cloud of anxiety. Well, today, we're going to get rid of that overwhelm. We're going to take all that chaos and turn it into crystal clear clarity.
Does this look familiar? You type how to study for the NCLEX into Google and boom, suddenly you're drowning in this absolute avalanche of resources. It feels like you have to watch every video, do every single practice question, or you're gonna fail. It's too much.
And that right there is the biggest problem we need to solve: resource overload. It's why so many of us just feel completely paralyzed. You have so many options that you either get stuck and do nothing, or you try to do a little bit of everything, and you end up spinning your wheels, making no real progress.
Now here's the crazy part. Every single thing on this list is actually really good. I mean, UWorld, Archer, Marquet, they are popular for a reason. The problem isn't the quality of the tools, it's the sheer quantity. Having all of this without a plan is like having a garage full of the best tools in the world, but no blueprint for the house you're trying to build.
So that begs the most important question of all. In this giant sea of different opinions and resources, is there one thing, a single source of truth that can be our guide, our map through all this noise? The answer is absolutely 100% yes.
And here it is. This is your map. It's the official NCLEX test plan, and it's published by the NCSBN, the actual people who write the test. This is your blueprint, so you can stop guessing what's important to study because this document tells you exactly what's on the exam. It's time to know your enemy.
Okay, so let's see how this map immediately gives us a strategy. The NCLEX isn't just a random collection of questions. No way. It's built around these 4 main client needs categories. And right away, what just jumps off the screen? Physiological integrity. It can be a massive chunk of your exam. I mean, up to 57%. That tells you exactly where to focus the bulk of your energy.
Now let's drill down even deeper. Inside that huge physiological integrity slice, there's a smaller piece of the pie called physiological adaptation. And that alone is worth up to 14% of your entire test. That is huge. This is where you find the really tough, complex stuff. We're talking about the different types of shock, ARDS, pancreatitis, and those big, scary emergencies like DIC and thyroid storm. See? Now we're not just studying blindly, we're focusing our energy where it actually counts. And this kind of targeted studying is absolutely critical for the next generation NCLEX. The NGN isn't about just memorizing facts anymore. It's all about testing your clinical judgment. And how do they do that? Well, they're not just going to ask you a simple question. They're going to throw a whole complex case study at you. A patient in multisystem organ failure or someone who develops a tension pneumothorax. Those high-stakes scenarios from physiological adaptation are the perfect way for them to see if you can truly think like a nurse.
So now that we have our map, the test plan, we can finally go back to that overwhelming list of resources and actually organize it. It's time to build a smart, focused toolkit. It's time to choose your weapons.
Look, the key takeaway here is that you do not need 5 of everything. You just need 1, maybe 2 good resources from each of these 3 categories. Your question bank is for practice and for learning from rationales. Your content review is for when you hit a wall and need a deep dive. And your strategy lectures are for those amazing high-yield tips. So, for example, if you're tackling physiological adaptation, you'd use UWorld to do questions on shock. Then maybe watch a simple nursing video to finally understand ARDS, and then listen to a Mark Klimek lecture to make acid-base balance click. See? It's a system.
Okay, so even within that system, there's always the big debate, right? The million-dollar question you see everywhere online. Which question big should I use? And it pretty much always boils down to the 2 big ones, and they actually serve slightly different purposes.
So here's the general breakdown you'll find from thousands of students. People say UWorld is the gold standard for its incredibly detailed rationales. It's an amazing learning tool because it teaches you the deep why behind every answer. Archer, on the other hand, gets praised because its questions feel a lot like the real NCLEX. Kind of vague sometimes. So it's seen as a fantastic assessment tool to see if you're really ready. A lot of people use UWorld to learn and build their foundation, and then switch to Archer in the last few weeks to test themselves.
All right, you have your map, you've picked out your toolkit, now comes the most important part of all, the battle plan. This is how you take all that knowledge and turn it into real, confident action with a study strategy that you can repeat day in and day out.
And here it is. It's a super simple but incredibly powerful 4-step loop. Step 1, test. Do a 75-question quiz on mixed topics.
Why 75? You're building that mental stamina. Step 2, review. And I mean you read every single rationale, even for the ones you got right. This is where the real learning happens. Step 3, remediate. Did you get all the pancreatitis questions wrong? Great. Now you know exactly what you need to go watch a video on. And finally, step 4, repeat. You just do it all over again the next day. It's all about consistency.
And this whole process brings us to a really important mindset shift. So listen up. You will never know everything there is to know in nursing. It's literally impossible. The NCLEX isn't testing if you memorized a textbook. It's testing your judgment. It's testing your ability to be safe. Your goal isn't to know everything. It's to learn how to make the safest choice with the information you have right in front of you.
Okay, and for our final piece of the puzzle, let's talk about a resource that you won't find in a book or on a website. It's the people around you. This is a really tough journey, and I'm telling you, you should not be doing it all by yourself.
So find your people. Whether you're diving into the forums on allnurses.com or scrolling through Reddit's r/PassNCLEX, find a community. Join a Facebook group. And hey, don't forget about your friends from your nursing school cohort. These are the people who actually get it. They'll celebrate your wins, and more importantly, they'll be there to pick you up on the bad days.
I want to leave you with this. It's a quote from some anonymous person on Reddit who passed, someone who is sitting in the exact same chair you're in right now. You know more than you think you do. Trust your training, trust the process, and trust yourself. Just let that sink in for a minute. You made it through nursing school. The knowledge is in there. This final step is just about trusting yourself.
So the only question left is, what are you going to do now? You have the map, you have the tools, you have the battle plan. So, what's it going to be? Are you finally going to master the pathophysiology of ARDS? Are you going to nail down the differences between the types of shock? Whatever it is, make a decision right now. What is the very first topic you are going to conquer?